Alright, so my name's Ariel Montoya, and I'm Hortensia's oldest son, and Hortensia is an ALS patient who's on a ventilator, and what we're about to do is we're going to go in and suction the trach and her airway for any kind of secretions or mucus that gets built up. There's a couple of signs that will tell you that it's time to suction. One being she's coughing a lot, which is the face that she makes right now. And also sometimes you'll hear kind of like a Darth Vader type sound coming from the trach, like the on the exhale, showing that there's a lot of secretions built up in the airway. We're using a sterile catheter, as well as I have sterile gloves on. The process needs to be maintained very clean. And right now what I'm going to do is I'm going to suction her mouth. This is kind of a hard tip suction machine. I have it hooked up to a portable suction machine. So I'm going to get any kind of secretions that are built up in the mouth and the back of the throat. Okay, so that takes those secretions out of the mouth out. I usually have 2 paper towels ready, one to clean her mouth, because you'll notice that when I do this, she might she's going to start coughing a lot more because it agitates the airway a little. Over time, the airway will get accustomed to that, and so I'll use the paper towel to wipe her mouth. The portable suction machine that I'm using looks like this. This is an Easy Go Vac, and we get it from our durable medical equipment supplier. Okay, so I'm going to go ahead and get started. Are you ready, Mom? This catheter has a hole that allows me to apply vacuum or not. When you insert the catheter, it's a good idea to have it open so that it's not suctioning while you're inserting it, and then on your way out, pulling it out, you'll actually cover this up and get suction built up.
Take oxygen away.
You're taking your airway away. Another thing to remember here is that when I'm doing this, she will not be getting air from the ventilator. So it has to be a quick process. A good idea is to hold your breath while you're doing this, and as soon as you feel like you've got to struggle, remove the catheter and give her air back because she's feeling the same sensation. Okay? So let's go ahead and get started. Okay. You ready, Mom? Huh? Okay. 1, 2, 3. Okay, so I insert it until I get some resistance. You'll hear that gurgling, that means I'm suctioning secretions out. And then give her back her air. Okay, so wipe her mouth. And then I'm also going to suction her mouth because she's been coughing. Good? Okay. So typically when we do this, we'll go in with the catheter 3 to 4 times. Make sure that it's nice and clear of secretions. I'll wipe the catheter off each time that I insert it.
You can hear when there's when you're picking up phlegm, and when you stop hearing that noise, that means she's pretty clear.
Okay, you ready, Mom? Okay. 1, 2, 3. Suction her mouth. Let's go in one more time. Okay. You ready? 1, 2, 3. That time, I really didn't hear much gurgling, which tells me that we've cleared the airway. So all that phlegm is now out of her airway. She can probably breathe a lot better, and then as soon as I finish suctioning her mouth, she probably stops coughing. And we do this every couple of hours, and also throughout the night. You know. A couple of times during the night while she's sleeping, she'll wake up with congestion. Do you want me to go in one more time? No? Okay. So she's done, and that's how we suction the airway routinely with the trachea.
And you might want to say she's only had it 3 weeks.
Right. This is only the 3rd week that she's had it, so she's healing pretty well, and that has to do with the care that she's getting and how we're staying on top of all the issues. You happy? Yeah? Okay.